Hi everyone, I'm going to be your nurse for today. Can you confirm your name and date of birth for me?
Carlos Thomas, January 4th, 2005.
Alright, and we already checked your vital signs before coming in here. They were all within normal limits. Are you having any pain today?
No.
Alright, good. I just want to note before we get started that upon you walking into the exam room, your gait was steady, your posture was erect, your speech so far has been clear, no slurring, and you have a very calm and cooperative affect today. Now, can you tell me what today is?
September 24th, 2023.
Okay, and where are we right now?
Auburn, Alabama.
Alright, and what are we here for today?
Regular checkup.
Okay, so a patient is alert and oriented times 4. Alright, I'm going to go ahead and start by looking at your eyes. So I'm just going to kind of pull down your lower lid first. Alright, so his conjunctiva is pink, his sclera is white, and his cornea is clear. Now I'm going to go ahead and shine this light into your eyes, so keep looking at this wall right here. And I'm going to go ahead and do this. Alright, keep looking. Now look at my pen. Alright, so patients' pupils are equally round and reactive to light and accommodation. Now if you will tilt your head up a little bit, I'm going to look in your nose. Alright, so his nares are patent, and if you'll stick your tongue out and say ah. Alright, so his oral mucosa is moist, pink, his uvula was midline, and his dentition is intact. I'm going to go ahead and feel your ears. Are you having any tenderness?
No.
And I don't see any redness, which is good. And you're obviously able to hear spoken word and respond, so that is good. Your hearing is good as well. And I just want to note the skin on your face, color and texture are normal for your ethnicity. I don't see any bruising, scarring, edema, lesions, or anything like that on your face. Now I'm going to go ahead and have you push against my hand here, push against here, and then go ahead and shrug against my shoulders. Alright, good. So neck and shoulder range of motion are, I would say, equal, bilaterally, intact, and normal for his age. Now I'm going to go ahead and have you take off your shirt for me. We're going to listen to your heart. Now today we're going to listen to 5 auscultatory areas, starting with the aortic, which is going to be second intercostal space on the right sternal border. And then we're going to go over to pulmonic, which is going to be second intercostal space left sternal border. And then it'll be Erb's point, which is going to be third intercostal space left sternal border. And then it'll be tricuspid, which will be fourth intercostal space left sternal border. And then we'll go to mitral, which will be fourth, fifth intercostal space left midclavicular line. Before I do that though, I just want to note that your chest, your skin is consistent with the rest of your body, and your ethnicity, still no lesions, bruising, or edema noted. Looks like you're pretty symmetrical bilaterally here as well. Before I do this as well, I'm going to go ahead and feel your carotid arteries. I'm going to feel this one as well. Alright, so I was able to palpate both carotid arteries. I would say they were both a +2 for today. I'm going to go ahead and listen for a carotid bruit. Go ahead and take a breath and hold it for me. Okay. Alright, you can release. Do it one more time. Alright, good. So no bruit was noted. Now I'm going to move on to those 5 auscultatory areas that I was talking about earlier to listen to your heart sounds. So here we've got aortic, pulmonic, Erb's, tricuspid. Now we're going to listen to the mitral area of your apical pulse for a full minute. Okay, starting. Start now. Alright, so I got your heart rate at 82 beats per minute. I was able to hear regular S1 and S2 sounds, no extra heart sounds like clicks or murmurs or gallops were heard, which is good. Now I'm going to go ahead and listen to your respirations as well while we're here. Before, I just want to go ahead and rate your breathing, which is quiet, effortless, steady, and rhythmic. Your respiratory effort. Respiratory effort. So now I'm going to go ahead and listen to 6 anterior spots and 10 posterior spots as you breathe. Every time I move the diaphragm of my stethoscope, I want you to take a deep breath for me. If you start feeling lightheaded or dizzy, just let me know, okay? Okay. Go ahead. Alright, now if I can get you to turn this way a little bit so we can see your back. Alright, here we go. Alright, so both your anterior and posterior lung sounds were clear. I wasn't able to hear any adventitious sounds such as crackles, wheezes, or bronchi, or anything like that. Now I'm going to have you close your eyes for a second for me. Can you feel me touching you?
Yes.
Okay, good. And then his skin here on his arms, consistent color for his ethnicity. He does have a little bit of a tan on his forearms, but still consistent for his ethnicity and pretty much consistent with the rest of his body. Skin is warm to the touch. I'm going to go ahead and assess your capillary refill. Okay. So brisk, less than 3 seconds bilaterally. I'm going to go ahead and assess the strength of your shoulders again while we're here. Push against me. Good. Now let's see, can you move your elbows? All right, what about your wrists? Sure, show me the other side. All right, now kind of hold your hands up like this. Push against me. Pull against me. All right, and can you grab my fingers? Kind of pull with your, I'm sorry, squeeze with your hands. All right, so strength and range of motion in his grip in his fingers, his elbows, and his shoulders are all equal bilaterally and normal for his age. I'm going to go ahead and have you lay back on the bed. And while you do that, I'm going to move the camera. We're dying. Crap. All right, so I'm going to go ahead and look at your abdomen. Are you having any tenderness today?
No.
Okay, good. And then, let me make sure we're still recording. Okay, sorry. Okay, no tenderness. And then I'm looking at your stomach. It's not distended. Its shape is uniform, symmetrical. Color is consistent with the rest of your body and your ethnicity. I'm going to go ahead and listen to your 4 quadrants for bowel sounds. I was able to hear intermittent bowel sounds in all 4 quadrants. I categorize it as normal active bowel sounds. Let's see, I'm going to go ahead and listen for a bruit while we're here as well. Sorry. Let's go ahead and do that. Alright, so no bruit detected here either. I'm going to go ahead and palpate your abdomen. Let me know if you have any tenderness. Anything?
No.
Okay. Alright, and I want to note while we're here, there's no JVD, and while he's lying in the supine position, will you kind of raise up for me a little bit to your head back? Perfect. No JVD noted in at 45 degrees either. I'm going to have you close your eyes for a second. Can you feel me touching?
Yes.
Okay, good. The sensation is intact in all 4 of his extremities. Looking at his legs and his arms, there's no pallor or cyanosis, no edema, lesions, scars, bruising. His legs are also warm to touch, as well as his upper extremities. So we're looking at that. I'm going to check your capillary refill. Alright, so capillary refill for his lower extremities as well was brisk, less than 3 seconds, which is good. And then we're going to go ahead and feel your pulses. Check for your pulses. I'm going to start with dorsalis pedis right here on his feet. Alright, so the dorsalis pedis was palpable. I would give it a +2. Now we're going to go to posterior tibial. Also palpable, a +2. If I'm not going to assess his femoral pulse today, but if I were, I would say it would be right about here on him. I'm going to check your brachial pulse. Alright, also palpable, +2. Now I'm going to do your radial. Okay, also palpable and +2. Now we're going to check your range of motion in your legs. Can you move your feet for me around? Perfect. Can you bend your knees? Can you pull your leg out this way for your hip? Perfect. Now push against me. Perfect. You can go ahead and rest. Push your foot against me. Against me. Against me. Same here. All right, I'm going to go ahead and do this. And can you turn out that way? Perfect. Push against me. Perfect. Now you can relax. All right, so it looks like range of motion in his hips, knees, and ankles and feet are all normal and intact, and what we would expect for his age as well. Now I'm going to have you sit up on the edge of the bed one more time. We're going to check your patellar reflex here. Perfect. Alright, and if I wanted to check your clonus reflex, I would hold your foot in the extended position, and when I release it and you put it back to normal, if I saw any shaking or tremors, then that would be positive, but you would have a negative clonus reflex for today. So now I'm going to go ahead and leave you with the bed break on, the bed in the lowest position, and we're going to have your side rails up ×2. I'm going to leave your call light within reach, and I'm going to go ahead and leave to document and make sure that I maintain HIPAA while I do so. Do you have any questions?
No.
All right, so your call light is in reach if you need me for anything else.